Hello, everyone. I'm Francis Collins, currently serving as the lead for the White House initiative aiming to eliminate hepatitis C in the United States. And I'm glad to join this webinar, although I'm sorry I'm doing it by a recorded video because I will be on an airplane at the time of the actual event. But very glad to have a chance to say a few words about this really remarkable national initiative that has the promise of saving many lives and many billions of dollars. What's not to love about that? Hepatitis C affects an estimated 4 million Americans. That's CDC's most recent estimate. We don't really know for sure because a lot of them don't know they have it. It has this long, slow course without much in the way of symptoms until you turn up with liver failure, liver cirrhosis, liver cancer, and sadly, often early death. But we have a cure. We've had a cure now for almost 10 years. But unfortunately, access to that cure is not available to many of those 4 million people. That doesn't seem right, and that has sparked our drive to action. When I was serving as the president's acting science advisor back in 2022, my senior advisor, Dr. Rachel Florence, and I identified hepatitis C as one of those areas that a full effort across the government could actually do something pretty remarkable. And with lots of assistance and advice from CDC and FDA, CMS, HRSA, SAMHSA, Indian Health Service, the Bureau of Prisons, we were able to outline a plan that ought to make it possible to reach out to most of those folks in a way that would be affordable and achievable in a 5-year period. So this led to the development of a bold program which is currently the subject of bipartisan legislation sponsored by Senators Cassidy and Van Hollen, and which we believe has a reasonable chance, maybe even a pretty good chance, of being enacted into law. The 3 parts of the national initiative: one was a subscription model following the lead of a pilot in Louisiana to try to make the access to the cure affordable. The second was a comprehensive public health program of healthcare delivery outreach for prevention, for education, and care so that many of these marginalized populations could in fact be reached and successfully treated. But the third part, which we're talking about today, was the need for an acceleration of diagnostics to improve testing across the nation. Because at the time that we started this, somewhat shockingly, the U.S. lacked a point-of-care test, even though other countries like Australia had those available for some time. In the U.S., it required oftentimes as many as 3 clinic visits before a diagnosis could be made and treatment could be started. And we know we lost a lot of people along the way because they weren't feeling ill and they had other things that they had to wrestle with. So point-of-care tests allowing test and treat in a single visit became a big priority. We convened key federal agencies in the summer of 2022 to build support for this and proposed leveraging the success of the RADx ITAP program, which had fast-tracked COVID-19 home tests to considerable success, to do the same for hepatitis C. And in fact, with a lot of support, some tin cupping that I did across CDC and NIH and other folks who came forward to say, this is so important, let's figure out how to do it even before we have the legislation. The program rapidly progressed. And in somewhat of a record period of time, by June 24, FDA authorized a hepatitis C point-of-care diagnostic test based on rigorous clinical testing in the U.S., showing that it had the desired specificity and sensitivity. This was a significant milestone in this national effort. Buoyed by that success, RADx ITAP is now tackling another critical gap, the development of a test for hepatitis B, which will be a crucial step forward in managing both hepatitis epidemics in the U.S. So here we are in October of 2024, looking at the possibility of this program actually coming into being in the not too distant future, if in fact Congress can see their way forward to bipartisan support. And we're encouraged by the fact that the Congressional Budget Office has been signaling signs that they might very well see that this could be a program that actually saves money in the first 10 years because of all the healthcare problems that we will be able to prevent by getting people cured instead of having them afflicted downstream. of various problems such as liver failure, liver cancer, and oh, by the way, also diabetes and kidney disease, which we know are part of this disease and which, with cure, can have their risk greatly reduced. So it's an exciting time, an exciting topic. I want to thank Nate for having put together such a great lineup of people to present, and happy to have a chance to kick this off and wish you all a really interesting conversation about this topic of how we're bringing the best of diagnostics forward to make this happen. Finally, I just want to say, from my small but mighty team of Rachel Florence, who I've mentioned, Josh Sharfstein from Hopkins, Risha Irvin from Hopkins, and Kevin Klinkenberg from HHS, we are delighted to see that in this case, all of government coming together to do something that is going to be a great gift to humanity. Thank you all, and have a wonderful webinar.